welcome back to Aspect Health's channel. I'm Alicia, part of the Aspect Health team. I'm with our Chief Medical Officer here, Dr. Basma Faris, and we're going to be talking all things periods. Now, we have a question for you. Do you really understand your menstrual cycle? Most of us, unfortunately, don't, even though the average woman will have over 450 periods in her lifetime. So it's definitely valuable to know what is happening in your body, what changes you can expect. So I am here with Dr. Basma Faris, not only our Chief Medical Officer here at Aspect Health, also a practicing OB-GYN, culinary medicine specialist, former registered dietitian, having over 20 plus years of experience in women's healthcare. So we're going to find out so much with Dr. Basma Faris here. First of all, thank you so much for being with us here today. So let's start with the basics, as always.
Okay.
What even is our menstrual cycle in simple terms?
In simple terms, our menstrual cycle is the cycle that our ovaries and our uterus go through from basically one period to the next period. So when we ask you for your cycle length, that's really what we want to know, is the length of time between the first day of one period to the first day of the next period.
Of course, it's divided by these 4 phases. So we're going to get into depth a little bit about each of these phases. We're starting with the menstrual phase. So let's say from days 1 to 5. What happens in our body during this phase?
So at this time, right before the menstrual phase, at the end of the luteal phase, so what signals the transition from the luteal phase into the menstrual phase is that the hormones drop. Mm-hmm. And when estrogen and progesterone drop, they no longer support the lining of the uterus called the endometrium. And if you're not pregnant, it sheds. And when it sheds, it comes out as your menstrual period. It's a mixture of blood, some mucus, and some cells that need to be, that are sort of dying and need to be eliminated, and sort of starts the next cycle fresh. So that's really all that the period is.
Got it. You mentioned that, of course, like the hormone levels drop. Does that also have like a reflect on our moods? Like, do we feel more tired? Do we get bloated? Is it more so in the other phases?
I mean, you can, right? Some people have very mild periods. They have some menstrual bleeding for a few days and maybe they'll feel a little bit of fatigue. But it can be associated with some bloating, some cramping, some changes in bowel habits, and some changes in mood. Some people may just feel kind of down or just a little bit, sometimes a little bit all over the place, and that all can be normal.
So then moving on from days 1 to 13, we're going into the follicular phase. So what happens during this phase? How can we expect to feel? What's going on inside our bodies?
So the follicular phase actually overlaps with our menstrual phase, right? Because the menstrual phase is the first several days of the menstrual cycle. The follicular phase is also the time from the beginning of the cycle to ovulation. And so you may be bleeding at the beginning of the follicular phase, and then you have another several days until ovulation. And so what's happening there is that our ovaries have a bunch of follicles that have already been recruited several months prior, and one of them is sort of picked as the one, depending on, there's different characteristics, but one of those follicles, sometimes more than one, will mature and grow, and the other ones will just kind of retreat. And as that one matures and grows, we will see some changes. They'll produce more estrogen. And then that rise in estrogen will lead to an increase in first FSH, which is one of the pituitary hormones that comes from inside our brain. And then following, when the FSH gets high enough and the estrogen gets high enough, then LH will be released, and that will signal time for ovulation. So in that follicular phase, that one lucky follicle, maybe 2, is recruited to grow and produce more hormones, and that is going to be the one that houses the egg that will be released.
So what about the other follicles? Do they just kind of rupture, or do they just like disappear? Like, what happens to the rest of them?
They just disappear. Yeah, They do just disappear. So every month we recruit a whole bunch of them, and only one or possibly 2 goes on to to be the one.
Is it like choosing the strongest one almost, we could say? Like, or it doesn't...
Yeah, I think it's the strongest, most like healthiest one that produces the most estrogen, that has the most receptors. There's a lot of things that go into recruiting. It doesn't necessarily mean that it's the genetically most healthy egg, right? That one has nothing really to do with the other, as far as I understand it. Just that it like is the one that is, maybe it has the most receptors, or maybe it has the best blood flow, or whatever the case may be, so that it is the most robust one, or produces the most hormone.
Moving after the follicular phase, we have our ovulatory phase. So what happens during this phase? If I'm listening to you before, this is kind of like the key event, honestly, in our menstrual cycle.
So what happens here is that one follicle gets big enough. It gets to be like somewhere 2 to 3 centimeters. So, a small cyst. It's visible on ultrasound, and it can be measured, and it's producing estrogen, and that tells our brain when it gets to a certain size to release LH, and LH signals the cyst to open up and release the egg. And that egg gets released, and it goes into the fallopian tube and awaits fertilization by sperm. That is your intention, or maybe if it's not your intention, the same cyst converts from producing primarily estrogen to now producing some estrogen, but progesterone, which it was not producing in the first half of the cycle.
The ovulatory phase, that's when it starts making more progesterone.
So it starts to produce more progesterone after the egg is released.
Got it. Okay. So now we understand what's going on like inside. During the ovulatory phase, like I remember you mentioned like the mucus changes. Like, what are some of the signs in our body that we're ovulating, that this is occurring?
So leading up to ovulation, the cervical mucus changes. It becomes more abundant, and it becomes thinner and stretchy. And we call this egg white cervical mucus because it literally looks like egg white. And that makes it basically it's kind of like a sperm superhighway, basically. And you can sort of track the changes in your cervical mucus. And then also the cervix itself gets softer and opens up. And that allows for the sperm to traverse the cervix and go into the uterus. And so those changes, those are occurring prior to ovulation.
Got it.
At the time of ovulation, or around the time as that cyst is growing and gets ready to burst, and when it opens, you may feel it, right? You may feel a little twinge, some mild pain. In rare cases, it may be more than mildly painful. It can be, for some people, significantly painful. And that occurs when ovulation happens, and that should resolve in about 24 hours or so. And then afterwards, you will notice the cervical mucus will get thicker again, because that's the effect of progesterone. And you'll have some other changes, like you'll see it, if you're tracking your basal body temperature, it will increase after ovulation about 1 degree Fahrenheit. So you can track that. That's usually a surefire sign, as long as you don't have like a fever or something else, like some other reason to have an increase in your temperature. That's a pretty surefire way to distinguish that ovulation has occurred. And then that corpus luteum that I mentioned will be producing progesterone until the very end of the luteal phase.
And you mentioned about the pain that you can sometimes feel it when it gets ruptured. Is it different than like the normal kind of menstrual cramps that we feel? Is the pain like maybe sharper, or is it like not that distinguishable?
It should be different in its location, right? It's on one side or the other where the ovaries are. The ovaries are on the sides of the uterus, so it should be localized to one side, whereas menstrual type cramping usually sort of across the whole pelvis, or maybe centered more in the middle, unless somebody has endometriosis, but that's a topic for another day. If somebody doesn't have endometriosis, sort of the cramping that they may feel will be in the middle of the pelvis, or sort of diffusely distributed all over the pelvis, versus what we call middle schmerz, right? That pain that somebody can feel with ovulation will be localized more to one side.
I remember in one video you mentioned how we kind of think about the menstrual cycle in the wrong way, how we think of like the bleeding as the central event when really it's the ovulation. So in the event, like let's say we're bleeding but we're not ovulating, how does that even, how is that possible? Like what happens in there that that doesn't occur?
So some people don't ovulate regularly for various different reasons, PCOS being the most common reason, but not the only reason. Because the ovaries are still producing testosterone, and estrogen. The lining of the endometrium. So we've talked about what happens in the ovary, but we haven't really talked about what happens in the uterus, right? And so the lining, the endometrial lining, is that sort of tissue that lines the uterine cavity. And estrogen causes that to grow and become fluffy. And what can happen is, what I like to think of it, like a good analogy is, you build a brick wall with no cement. So you can sort of get that wall to be kind of high, right, if you stack them. Mm-hmm. But if there's no cement, it's fragile. And eventually you're going to build it, and some of those bricks are going to fall off. That's what happens if you have a lot of what we call unopposed estrogen. The lining of the endometrium will build up, and it will get thicker and fluffier, but eventually it'll become unstable, and some of it will come out.
Okay.
And this is called an anovulatory bleed. And so somebody can still have a quote unquote period, but it didn't follow the same pattern that we just talked about, with ovulation occurring first and then the menstrual period. What progesterone does, right? That lining builds up in the first half after your period stops, the follicular phase, the ovaries are cranking out estrogen, that lining builds up. And then after ovulation, the ovary produces progesterone. That actually stabilizes the lining. So I liken that to the cement. Mm-hmm. So as long as estrogen is present and then progesterone is present afterwards, that lining should be pretty stable. It's preparing for pregnancy. At the end of the luteal phase, when estrogen and progesterone dips down, now that cement is gone, and all the bricks fall.
So the bleeding is really just the uterus lining shedding, but not necessarily like the egg being ruptured. So the ovulation
it has nothing to do with the egg. So we have to think about our menstrual cycle. There's the sort of what's happening in the ovary, and then there's also what's happening in the uterus as a result of the hormones produced by the ovary.
How can we understand that as well in relation to like the cycle? So you mentioned about the pituitary, I don't even know how to say that correctly, the gland in our brain. How does all of this relate to our menstrual cycle?
Sure. So the pituitary gland, it's a little gland in the base of our brain that produces some of our master hormones. Mm-hmm. And FSH and LH are the two that sort of control our menstrual cycle. They're supposed to be, both of them, low at the beginning of the menstrual cycles during your period. As that follicle grows and the estrogen increases from the ovary, eventually that signals the pituitary gland first to produce more FSH, follicle stimulating hormone, right? That's what it stands for. Its purpose is to grow that follicle so that to get it ready for ovulation. Yeah. And then luteinizing hormone comes later, towards the end of the follicular phase. It's released in one big spike, and that tells the mature follicle to release that egg.
Wow.
After ovulation, they both fall again. Okay. They're mostly active in the beginning of the cycle.
That's incredible. That's like something I didn't know before until, of course, recently with like our videos and stuff. So it's like our brain kind of controls also what's going on with our ovaries and our whole menstrual cycle and stuff like that.
Yeah, there's talk between our ovaries and our brain in both directions, right? Mm-hmm. The pituitary gland is signaling the ovary, but also the ovary is signaling the pituitary gland as well. And disruptions in that can lead to disruptions in the whole cycle.
And now you mentioned a little bit before about the corpus luteus. So you already mentioned that it's like a Latin term and it's yellow. It looks like a yellow body. When does it occur and what is it? And a little bit more depth about this term.
So the corpus luteum is the cyst that is in the ovary after ovulation. That follicle ruptures and releases the egg, and then that same cyst turns into the corpus luteum, and it switches from producing mostly estrogen to now mostly progesterone and a little bit of estrogen. Mm-hmm. So the same little structure has different functions depending on where it is in the cycle. And so it produces mostly progesterone, and that's why after ovulation, we may have some, I don't like to say symptoms because it's not a disease, right? But we may feel the effects of progesterone, which may result in some breast tenderness, some changes in our gastrointestinal tract. Some people maybe experience some slowing of their gastrointestinal tract. Some people may feel like a little less energy, lower energy, a little bit sleepier during that time. And these are normal conditions of being, exposed to progesterone.
Mm-hmm.
And then if the body senses if the egg is not fertilized, then is not, we're not pregnant at the end of that cycle, then that corpus luteum will stop producing both hormones. Those hormone levels will fall and the period start and the cycle starts all over again.
Yeah. And so I guess this leads us to the luteal phase. So this is like towards the end of our cycle, days 15 to 28. How can we feel in our luteal phase? What's going on inside? What can we expect during this phase of our cycle?
Yeah, some people may notice changes in their mood, their emotions.
Yeah.
Progesterone can make some people feel a little bit moodier. Some people feel a little bit blue. Some people will feel a little bit sad. Some people feel no different. Mm-hmm. So everybody's different. They may find that their sort of like performance, athletic performance is a little bit less than in the first half. Some people may notice that some changes in their metabolism, that their insulin sensitivity may be less in the luteal phase than in the follicular phase. So all of these things may occur, and just sort of appreciating them and understanding that this could be something normal that's going on with your body, I think is really helpful.
We talked a little bit about what happens when we don't have the ovulation, but still with the period. What if we have the case where we don't even get a period at all?
So that sometimes happens where people don't get a period at all for several months. And that can occur with polycystic ovarian syndrome. It can be caused by changes in thyroid hormone, by hypothalamic amenorrhea. That's another common cause of not having a period. And basically there's maybe low levels of estrogen being produced by the ovary. The ovary could be producing testosterone, but it's not being converted into estrogen. We do see that sometimes, even in people with PCOS, that it's just not being converted to enough estrogen to have a sort of thickened endometrial lining. And so there isn't a period. And that is that's sort of your first clue that something's sort of arrived with your menstrual cycle. And in fact, it's probably the most common reason that people will go and seek help. It's a little bit less or more difficult to distinguish that you're having an ovulation problem if you're having sort of semi-regular periods, because most people associate, if you're having a period, then you're ovulating. But if you're not having a period at all, you're definitely not ovulating regularly, right? Because that means you're not making enough of any of the hormones for a period to actually happen. I mean, there are some exceptions to that rule. Sometimes people have scarring inside their uterus if they had a procedure, or, there could be something else structural going on inside their uterus. But largely it's because that whole cycle that we just discussed is not occurring.
With these hormones not kind of coming into place, which causes this absence of a period, do lifestyle choices ever affect that whole cycle?
There's sort of a few different circumstances in which lifestyle can play a role, right? If somebody has hypothalamic amenorrhea, that means those hormones from the pituitary gland are low. And that can occur if somebody is under eating, or we see that sometimes in athletes who are very, very active, right? And so that's sort of the classic scenario that we see that in. And so sometimes, a shift in lifestyle, nutrition, et cetera, can help to make that cycle resume. Sometimes it's due to medications and we don't realize that we're on a medication that's impacting our pituitary hormones. Sometimes it's another hormonal disorder, another endocrine disorder. So those are sort of some of the examples in which that can play a role. The other one obviously is PCOS. And we know that changes in lifestyle are first line treatment for polycystic ovarian syndrome. But that doesn't mean that every single person that makes a lifestyle change is not going to need medication to help regulate, right?
Yeah.
And so I think that's really important for people to know that, yes, they should be making some changes if it's appropriate, right? Some lifestyle changes. And if you have a condition like PCOS, that's the first thing that we want to do, but that it is a medical condition and it's not a failure if you're unable to spontaneously have a menstrual cycle, even though you've made some lifestyle changes, right?
Yeah.
Sometimes there are other things that we need to do. So I think that's a really important message, because I think sometimes that message is out there that like, you don't need medication. All you need to do is take, eat this way and take these supplements and everything will be fine.
Right.
And that isn't always the case. It's the case sometimes for some people, but it isn't always the case. And it's not because somebody isn't trying hard enough.
Right. Absolutely. So how does stress correlate to our ovulation? Like with the high stress levels, the low stress, is it important to keep stress at a low to have our reproductive health healthy and menstrual cycles healthy?
We are resilient as humans, and we as women are very capable. But when our stress gets so high that it is interfering with our sleep, it's interfering with our sort of circadian rhythm, then that really can disrupt. If you work remotely, this is something that I see. People who work remotely and don't get outside, they don't get outside early in the day, they work late into the night, keeping really late hours, that can disrupt your cycle. Stress can cause insomnia too, right? So especially if you're really stressed in the afternoon, and then maybe that's going to interfere with your sleep at night, that can certainly disrupt the menstrual cycle. We just discussed all the 4 different hormones, right? And there are others, but we just discussed 5 different hormones actually that was discussed that relate to our menstrual cycle. So that is a really sort of beautiful but vulnerable balance that needs to occur for our cycle to occur regularly. So any disruption in that really can throw off our cycles. It's really important that any person, but if you're an ovulating female, that you build in some things, even though you're working hard, that you build in, breaks, and that you take time and you don't let your sleep be totally disrupted, and, you're not burning the candle at both ends
Especially with stress, it can affect, of course, our sleep and cause insomnia. So how does sleep benefit our menstrual cycle? Is there like hormones that are secreted when we have a good sleep that help?
The ovaries require melatonin, right? Wow. Melatonin is a hormone that we produce to get ready for sleep. So our sleep cycle, or our circadian rhythm, the day cycle and night cycle are driven by cortisol and melatonin. Now, everywhere in social media, people talk about lowering your cortisol levels, lowering your cortisol. Cortisol is not bad. We need cortisol. We produce cortisol. That is what helps us. Without cortisol, we won't wake up in the morning, okay? What wakes us up in the morning? It gives us energy. It gives us alertness, right?
Yeah.
It helps us to function through the day. But as the day winds down, that is supposed to fall. And as it falls, melatonin increases and helps to put us to sleep. But actually, our ovary has melatonin receptors in it and needs melatonin to actually function optimally. So it's not just like the 5 major hormones that we talked about. There are some other things, like melatonin is important, insulin is important. There are other hormones that impact our ovarian function. And so if your sleep is disrupted or your melatonin production is low because you are staying up too late, drinking coffee too late in the day, not sleeping well, like you have your whole day-night cycle disrupted, you're working all night long, then that can impact your cycle because your melatonin production is inadequate.
Yeah, that's really fascinating. I didn't know that ovaries need melatonin and stuff, that you can see how it all kind of comes to play and why sleep is important. What about like smoking, alcohol? How does that affect our menstrual cycle? Like if you read about it, they say like on certain phases of your cycle, it's good to keep like caffeine at a low, alcohol at a low, and smoking. What is your stand on that? Like how does that affect our reproductive health? Do you think people should avoid that, or is it okay in moderation?
I mean, smoking, absolutely. There's really no upside.
Yeah.
Right? we think about smoking impacting our lungs primarily, but it impacts blood flow to our ovaries, right? We know smoking damages the small blood vessels in our body. So if your ovaries are not getting the blood supply, they're not going to function well, right? Yeah. And then not to mention all the toxic components that we are, right? If you are inhaling smoke, that's being absorbed into your body and that's damaging your cells.
Yeah.
So absolutely no upside to smoking whatsoever. There really isn't a benefit. We know that. And that goes for vaping as well. Alcohol. As we learn more and more about alcohol, there was a time where we thought a small amount was beneficial. And I still could argue that maybe a small amount, there may be some beneficial components in certain alcoholic beverages. And maybe if it sort of allows you to sort of unwind and socialize, that maybe there is some benefit in that, because we know relaxing and socializing are important parts of our health. But I think that really that benefit really becomes a negative when you exceed, really all the studies show that if you exceed like more than a drink a day for women, that there really is no benefit and potential harm on sort of every part of your body, right? Yeah. Not just, you think about your liver and your stomach. It also wreaks havoc on your metabolism and your sleep. People may find, they have a drink and it makes them fall to sleep, but it often results in disrupted sleep in the middle of the night. So even though you feel tired and you feel sleepy and you want to go to bed, usually the sleep is poor quality. And so that can have an impact on your health as well. And then caffeine really also, if it's keeping you awake later in the day, then that should be avoided. So it's fine in the morning and, it's helping you to wake up and to be alert and to function, right? Caffeine does help us to be more alert and be more productive. But late in the day, it should be avoided because it can interfere with your sleep. Now, everything has its upsides and its downsides, right? A lot of people for menstrual type cramps rely on what we call non-steroidal anti-inflammatory drugs, which are like your ibuprofen and your naproxen. And those are very, very effective, but they can have an impact on your stomach lining. So for every sort of positive, there can be a negative. Yeah. As far as nutrition, making sure that you have a diet that's rich in all of your anti-inflammatory nutrients, like your omega-3 fats and antioxidant vitamins. So those are like vitamin E and C and A. Zinc has been shown to be helpful also for what we call dysmenorrhea or painful periods. So there are some things that you can do naturally. And then if that's not sufficient for you, there are over-the-counter medications. And then there are also things like just, wearing comfortable clothing, using heating pads can be sort of an effective way of releasing. There are things like TENS units, like these little electrostim devices that you can use at home that people find to relieve pain. Massage, right? Both lower back and pelvic massage can be helpful as well. And then just sort of relieving other things that can make you uncomfortable. If you're having, some issues with constipation, that can exacerbate the pain. So making sure that you get enough fiber and getting enough hydration so that you're not having constipation on top of the cramps, which is just going to make everything worse, right? Yeah. So, all of the different things that you can do to help relieve. And then if you do all the things, and you still are having significant pain, then that is something that you want to talk to your doctor about to make sure you don't have something else going on, like endometriosis or fibroids or some other pelvic, floor dysfunction that has caused me to have pain with your periods.
If we were to look at it from a scale, like 1 being I don't feel any pain at all, 10 being like I need to go to a hospital, where do you think along that is considered normal for like period cramp pain?
Oh, that's a tough question because it really is so subjective for people, right? I've seen people with some severe, I don't love the pain score. I would say if it is interfering in your activities, right? That you're like, I can't go out. I can't go to work. I can't go to school.
Yeah.
All I can do is stay in bed. Like that, that shouldn't be. Right? Sometimes you're not in the mood for doing those things. That's fine. But if your pain is interfering, that you're losing out on things, you're missing out on things because of the pain, then that's not normal. But if you're having some mild discomfort that you can do all the things that we discussed and then sort of go on with your life, then it's not interfering with your life. Some people sort of learn to live with chronic disease, so they diminish their pain,
Right.
Or they just sort of have learned to live with things because they've either been dismissed by family members or dismissed by their doctors even. And so they have learned to sort of lessen their own pain, even though it's significant.
Yeah.
So I would say use that rule of thumb that if your life is being disrupted, if you're missing out on things because of painful periods, then that needs to be investigated.
I think what you're saying is very important. I think there's definitely that narrative that it's not just supposed to be a mild discomfort, that even severe pain, and that's normal, it's part of being a woman, it's part of having periods and stuff like that. But to have that rule of thumb that if it's interfering with like your daily life, that's definitely a sign that should be something investigated deeper. So I think that's deserves to definitely be highlighted.
And I don't talk about like my personal experience so much, but that's essentially what happened to me. I had a very severe endometriosis, and I was just told that by my doctor, who I then obviously went and found somebody else, that my pain was normal, and that I could just take ibuprofen or I could take birth control pills, and that was it.
Yeah.
And that was all that was offered to me. And, and I did take a lot of ibuprofen and ended up affecting my stomach, and I ended up ignoring my symptoms till it got really severe and I needed surgery. And by that time it was very severe.
Yeah.
So we don't want to just tell people what you're going through is normal, especially if you're requiring medical treatment for something.
And thank you for sharing as well. For a little bit personal anecdote, I think a lot of women can relate out there. And even though I'm a young person so far, I hopefully, knock on wood, there's wood next to me here, nothing happens more severe. I see it in even my mom, other women in my life, where later down the line, it was something severe, but unfortunately in their younger years, it was dismissed so much, they never ended up going to see a doctor. October 19th is National Period Day, so I think that's also definitely a day to even highlight it even more about period pain and to raise awareness. Are there any period care and hygiene tips that you recommend as far as should we be using soap down there, or do we just stick to water? Is just water enough? How often should we be changing our pads? Kind of good hygiene tips.
So if we're talking about washing, right, it's okay to wash the vulva with gentle soap. So the vulva is the outside, right? So with a gentle soap, it doesn't need to be a soap made for, the genital area. It can be a regular soap that you use on your body, or even, like a gentle face wash that you use, and because it is skin, you want to take good care of it.
Yeah.
And but if we're talking about inside the vagina, you really don't need to put anything inside the vagina other than water, because I know there are products that are out there that are designed for that. I don't recommend them. You don't want to disrupt the pH of your vagina, because that can lead to infections, bacterial vaginosis, other things. And so you really want to be careful with that. There's no need to do any special washing after your period. Okay. Same hygiene before your period and after your period. As far as menstrual hygiene products, it really is a personal preference. Now, all the great underwear options, there's really been so many new innovations in the last decade around period care, which I think is so great. I do tell people to try to avoid the fragrances. These are all sort of chemical fragrances that you're putting next to your vaginal tissue, which can then absorb those chemicals. And so I don't recommend that. There's sort of these pros and cons, right? They have the ones that are more, made with natural cotton. Unfortunately, they may not be as absorbent. So if you are somebody that does have a really heavy flow, then you may find that you need to change them more frequently. If you notice something is causing an irritation, maybe there's a product an ingredient in your pad. I'm not going to name names of certain brands, but I do remember, that I had some patients that were using a particular popular brand, and they were having some vulvar skin irritation as a result of that. I think menstrual cups are great. What a great innovation, reusable, right? So, more friendly for our planet, not creating a whole lot of waste. So if you can find one that's comfortable for you, also much more economic than, than spending so much money on all of these menstrual hygiene products, as they call them, period products.
Yeah.
So, use a combination of whatever works for you.
We were making this infographic because October 19th is National Period Day in the United States, and I think it mentioned that the average woman will spend $13,000 on menstrual products, which is insane.
And what's also crazy about that? That in some municipalities, states or countries, you pay tax on them.
Yes, the period
Sales
tax. It's insane.
Like
a luxury item. Yeah. Yeah.
Right? It's absolutely absurd.
I want to discuss the myths and facts, kind of the top 3, and I would love for you to debunk them. So this one myth, unfortunately this narrative sometimes goes around, is that period blood is toxic and dirty. Is that true? What is the truth on that one?
So some people feel like if you must have a period, eliminate toxins from your body. This is not true. If you're on a type of contraception that prevents you from bleeding, there's no problem with that. It is not necessary, okay? You don't need to have a bleed to clean yourself out.
Yeah.
Absolutely false.
And now the next one is that you can't get pregnant on your period. I think that one's quite a big one.
That is a big one. So remember, the follicular phase and the menstrual phase overlap. They're occurring at the same time. Mm-hmm. Now, if you have a longer period, right, a normal period length is anywhere from 3 to 7 days. So let's say you bleed for 7 days, and let's say your total cycle length is less than 28 days. Maybe it's 26 days. Yeah. That means you ovulate on day 12, right? You do the math. Sperm can live in your uterus waiting for an egg for 5 days.
Oh, wow. That's sneaky.
So if you have sex on day 7 and you ovulate on day 12, do the math. You can still get pregnant. Now, if you know your body and you know that you have 30-day cycles and you ovulate on day 16 and your period only lasts 5 days, then you're probably safe. But you have to know your cycle to know whether or not you're in the clear, so to speak.
And now the last one is that you shouldn't exercise on your period. So I think especially now, there's a lot of videos and content out there of what type of exercise you should do for each phase of your cycle. What is your stance on that? Should we exercise on our period? Does that help with cramps, or are there certain exercise that we should be doing less of, more of?
Yeah. So this is sort of one of those things. Yes, if you feel like it, you should exercise, right? Don't push yourself if you really don't, but oftentimes you may be happy that you did and feel better that you did.
Yeah.
If you are bleeding heavily, you may not want to do such a vigorous exercise because you may have some mild anemia and you may not feel so energetic in that time. So do something a bit more gentle. But movement does usually help, because movement helps us to release some endorphins, and that helps with pain. So that is really, really key. Do what is comfortable. If for you, that's just taking a walk. If for you, that's doing yoga. If for you, that's swimming. Swimming sometimes feels really good when you're on your period, because just the lightness. Do what feel good, but there's no reason that you have to avoid it. Get the menstrual products that allow you to be active, wear the clothes that allow you to be comfortable, and move your body in whichever way feels good for you. But there's no reason why you can't. You and I had this conversation the other day, which I think was really important.
Yeah.
I think we need to know our bodies and know when we're going to be peak performers and when maybe we're not going to be performing as well. But I don't think that should stop us from doing things. It just should allow ourselves to give ourselves some grace and appreciation. If, you hit your PR at the gym in your follicular phase and, 2 weeks later, you're like, oh, I'm not performing as well today. Okay, fine, but it doesn't mean that you don't do it, right? Let's not be, I don't like this narrative that we as women, because we have menstrual periods, are less than or not capable or these fragile creatures. We're not. We just need to understand ourselves and be like, okay, I'm going to give myself a little bit of, extra time, or just not expect that I'm going to hit my PR, or I'm going to be at on it or as energetic this week. You just try to maybe you change your workload, or you try to get a little bit more done when you're feeling a little bit better, so that you know that you're at the game, right, for the next week, but not, I think it's like when we feed into that, we're feeding into some patriarchal values that women shouldn't be in certain places and be in certain roles because we're not good all month long, right? And so I don't want us to take that narrative too far. I think I want us to recognize our bodily changes and what that means for us, and how we can sort of adjust our expectations of ourselves. I don't want us to be labeled as such, or as weak because of that. And so I think there's that, that balance that we need to strike between understanding but still being our amazing selves.
Beautifully said, especially kind of beautifully wraps up this entire video. Like, it's not to say that we're just productive for, during our follicular phase, but we can do great things all the time, all day, every day, not matter where we are in our cycle, but just to be able to understand what's going on inside, if we're feeling a certain way or such, to be able to, like you mentioned, give ourselves a little bit more grace and understanding. If you liked today's video, definitely like and subscribe. Again, we kind of mentioned about it briefly. October 19th is National Period Day in the United States, so we wanted to make this video to kind of make period talk a little bit more normal, less taboo, get people talking more about their periods so we understand what's going on, if there's anything that you have to bring up with your doctor, and just a reminder that we're capable of so much and we're so resilient, and our periods are just one of the many testaments to that. So if you have any questions, perhaps for other suggestions for videos, any questions about your period that you'd like to ask Dr. Basma, drop them in the comment section below, and we cannot wait to answer them. So Dr. Basma, thank you again for being part of yet another video, helping us understand more about our bodies. We all appreciate your knowledge and coming here today. So thank you so much.
Thank you.
And we'll see you guys
next time.
Yep, in the next video. Bye.